All right, you guys can still see?
Yeah, quick question.
Yes.
When I talked about the Google Classroom, did you want me to share my screen for 30 seconds
Yes.
to show it? Okay.
Yes.
And then
So
I'll also put the link in the chat.
Yes.
Okay.
And are we recording this?
Yes, we'll be recording. All right, so I'm getting ready to hit record, okay? Oh, I think we're just live. The live stream is on, so if you want to check, good afternoon, everyone, and welcome to the Black Angels Book Club event. We are so excited to hear you, to see you, and connect with you. And welcome to the National Book Club event, co-sponsored by a whole host of people, which we'll go through. My name is Dr. Danielle McCamey, and I am the founder, CEO, president of DNPs of Color. Before we get started, we'd love for you to take a moment and let's get social. Please share on your social media networks that you are here at the Black Angels Book Club event. Please use the following hashtags and post your pictures of you with the book or screenshots of us here live on Zoom. We also are broadcasting live from our YouTube page as well. So we would love for you all to share with your communities that you're joining us for this wonderful book club event. We also want to let you know that we will be recording this. So if those that want to review it later, you have an opportunity to check it out or share it with your communities. As I mentioned before, I'm Dr. Danielle McCamey, founder, CEO, president of DNPs of Color. And the mission of DNPs of Color is to serve nurses of color with their doctorates through networking, mentorship, and advocacy to increase diversity in doctoral studies, clinical practice, and leadership. And it's such an honor and privilege to be here today because something that started off so organic and small has turned into a huge national collaboration, which we are extremely excited and really, really hopeful that you all find time to connect with this history that had been untold for so long, but now is being told across the nation, international. And many thanks to Maria Smilios for bringing voice to the Black Angels, and also Virginia Allen being the cornerstone of sharing this information. But I wanted to just give a shout out to Dr. Lucinda Canty. It is Black History Month, so happy Black History Month. And the theme for Black History Month is African Americans and the arts. So we wanted to take the time to highlight Dr. Lucinda Canty's work. She is a scholar, activist for women's health, reproductive justice, and we are highlighting a couple of her pieces here. The first piece is Representation in Nursing. The second one is We Celebrating, and the third one here we have is Black Women Pregnant. So if you like to learn more about Dr. Canty, please scan the QR code that will link you to the Nurses You Should Know webpage that has the story featuring her bio and about her work. I'll give you a moment to scan. So why we're all here, and I blame Miss Virginia. So we had the wonderful opportunity to host Miss Virginia and Maria at the DNPs of Color third annual national conference back in October in Washington, D.C. And prior to Virginia coming down to the conference, she and I had a one-on-one conversation because I really wanted to get the opportunity to meet her and to learn more about her story, because I was just so amazed that what she considered just to be her work as usual, along with her colleagues, turned out to be one of the contributions to one of the major medical breakthroughs. And I was just in awe to actually have the opportunity to meet a Black nurse that had such a significant role in advancing health. And, like a lot of us stories that we're nurses, this is just our job. It's what we do every day. But in that conversation, she was so excited to meet me and so excited about the opportunity to come to the conference. And I was just like, I can't believe you're excited for us. Like, we're excited to receive you. But she's like, yeah, but I need you all to be ready for me. And I'm like, okay, great. We'll be ready, whatever you need. And she's like, but I see the amazing work that you all are doing. And it's important for me that this story of myself and colleagues gets out to every nurse out here. And so I was like, consider it done. And she was like, and second, within that, I want you to make sure that the work that we're doing in advancing diversity in nursing, that we offer opportunities for nurses or folks that are interested in nursing, the ability to be able to go to nursing school. And so that's when we decided to create the Black Angels Scholarship. And so we are actively collecting donations so that we can start following up on the charge to provide scholarships to those that are interested in going to nursing school, but might not have the financial means to support their way through school. So we are here because of Virginia Allen and the Black Angels, and grateful for the charge that she placed on me, being the leader of DNPs of color. And we are here gathering today for our first big event of the year during Black History Month, honoring the life and legacy of the Black Angels.
Hi, everyone. My name is Ravenne Aponte, and I am co-creator of Nurses You Should Know and historian of DNPs of Color. As a lover of history, I am so excited that you all have taken the time out of your Saturday to join us for our Black Angels Book Club kickoff. Although I am unable to join you all today, I wanted to provide just a background about myself and Nurses You Should Know and speak to the growth of our project, which is largely due to the support and guidance received from many of you all here today. Now, I am a registered nurse who has primarily worked in critical care and community health, but my first degree was in African American studies, which is where I like to tell everyone my first interest in nursing really began. And it was through my coursework that I learned so much about the ways women of color, specifically Black women, cared for their communities, sometimes by force, but often as genuine community caretakers. They provided health care and did everything to improve the health of individuals and their community through passed down remedies, as midwives, and eventually as trained healthcare professionals such as nurses and physicians, dentists, social workers. And it was these efforts that really went on for 200 years that ensured that people were able to receive healthcare even in, segregated and discriminatory systems. So when I got to nursing school and even went into practice as a nurse, I was surprised, but also not surprised to see how the contributions of not just Black nurses, but nurses of color was overlooked within, the nursing curriculum and nursing history as a field. So as a nurse who is always looking for a solution, I decided to pursue my PhD in nursing with a specific focus in nursing history in hopes of rectifying that gap and looking at the ways in which history intersected with nursing practice, research, and education, and whether that was in the past, present, and even our future. So in 2020, I started my doctoral journey. And once again, I was shocked at how much information and stories and archival data was just, sitting in archives and honestly people's basements collecting dust and not being shared, with all the nurses and healthcare professionals. So I really started thinking and brainstorming ways that I could get this information out there and into the public and not just wait for a publication or for my dissertation to be finished. And thankfully, I wasn't the only one brainstorming. Joanna, my partner in crime, was also going through a lot of these same questions. So I won't go through all the details, but Joanna and I connected in 2020 and co-created Nurses You Should Know. And our goal was really to craft a project that would center the stories of nurses of color and limit a lot of the barriers to accessing this history. So we initially focused on curating short biographies of nurses of color, and they were mobile friendly, engaging, not blocked by that paywall, and broad enough so it wouldn't feel, like a heavy lift to incorporate into a company presentation or into a curriculum or syllabus. These biographies now include present day nurses who are making history right now. And we've continued to think about this idea of living history. So today I'm really excited that we've been able to continue this mission and continue to evolve over the years. And also happy that we've been able to collaborate with DNPs of color and all of our partner organizations to highlight such an important story. So I really hope that you all have a great discussion. I'm sad I can't be there with you all today, but hopefully I'll get to see some of you at our next discussion. And I hope you all just have a really great time. Thank you.
Thank you so much to Ravenne for fitting us in and being here virtually with us today. She definitely is. We are the partners in crime behind Nurses You Should Know. And last year I was finishing my dissertation literally in real time right now. She is working on her dissertation. We have very much connected through this work. We were connected by Sandy Kao, who is a professor and DNP when I worked as an adjunct at NYU. And in the first year of the pandemic, when we were connected, we were both in our doctorate programs. I was getting a doctorate of education in organizational change. And we were reading these dense scholarly histories. And we just felt like in the middle of a pandemic, nurses and educators really did not have the bandwidth to relearn so much of our history. So with the enthusiasm unique to two doctoral students bouncing ideas off of each other, and having access to the internet, we conceptualized a modern way to deliver nursing history content in a micro learning format. And part of the ethos of our project is really that so much of nursing education sometimes gives us a fear of failure. We feel like, well, what's on the test? Am I going to pass the test? There's no tests in the way that we envision learning. And also there's no sense of dread of, we want learning to have a collective feeling that we're sharing out and we're teaching and learning from each other. And we wanted to make sure that our content was accessible online, accessible on a phone. You could see it right on social media. And in 2021, the first month that we launched our project, Ravenne wrote the biography profile on Virginia Allen, and I will post it right here in the chat. And it's really one of those synchronous, serendipitous kismet moments that Dr. McCamey reached out to us and said, I just met the author of The Black Angels, and she knows Virginia Allen, and we are gonna have a panel discussion. And after we had that panel discussion at the conference in October, she said, now we're gonna do a book club. And here we are. We love being able to have accessible education when it comes to nursing history, because our whole project is about course correcting a generational knowledge gap in our profession. I have 2 degrees in nursing. I wasn't taught the full scope of our history in either degree. And I know that I wasn't alone. And I know that the educators teaching me weren't willfully withholding or omitting information to share about our profession. But we've had so many blind spots. And through the work that I did on my dissertation, I focused on how those blind spots have really gone on for so long because of our Victorian era iconography. And that has been holding us back, because when we kind of mythologize angels and this religious connotation of these beneficent nurses, that is prohibiting us from having real conversations about the American history that influences our profession. And it has really given our profession these very it beholds our profession to very gendered and racialized ideas of who can be a nurse. So a lot of our project is about expanding the scope and the narrative of the origin story of our profession, and really recognizing that healing work is intrinsically global and transcultural. It's not only the purview of English-speaking women. We have such an amazing profession, and we are really working on expanding the legacy of whose stories are told that have shaped our profession. So in meeting Maria and reading her book, the way that she was able to really crystallize these ideas and have such a cinematic way of crafting and humanizing these large stories of history and the social tensions and what was going on in our early professional nursing years across the decades that are covered in her book. It was such a joy to understand and know all the research that had gone into having to tell a story like this. And having read so much history by historians, I had also never read a story that was so digestible. And you are turning the pages and you're going from section to section, and you're really there in those eras of healthcare and in our country. So without further ado, I want to give the stage, this virtual stage, over to Miss Virginia Allen, who will welcome you to this first kickoff of our book club. And thank you so much for being here.
Good afternoon. I am so happy to be here with you on our first meeting of the book club. My Aunt Edna and the rest of the nurses who worked here at Seaview would be most delighted to join us, and they may be. We don't know that. But I'm happy that the history is being told and their legacy is being carried out.
Short, sweet, powerful. So thank you, Miss Virginia. Thank you, Joanna, for rolling with a sister. I tell you, I get these ideas, and I'm so grateful that I have a community of people around me that see the vision, or might not see the vision, but at least trust me and moving forward, and just really, really honored and grateful for Joanna in so many ways. More than but also want to pause and thank future Doc Shantae Harris. At the conference, she was so moved by the Black Angel story and Miss Virginia Allen that she donated so that everyone at the conference had their own copy of the book. We had 300 registered attendees, just to let you know. So thank you to her and her generosity and her being a huge inspiration. And we are excited to welcome her to the DNPs of Color family once she crosses the stage after completing her DNP. But thank you to future Doc Shantae Harris. We also want to thank our co-sponsors. So if you're a co-sponsor and you're in the building, please unmute and say hello. We would love to recognize you while you're here. But the National Commission to Address Racism in Nursing, I believe our representative is Dr. Katie Boston Leary.
Yes, hello. And Cheryl Peterson is here too. Very excited and honored to be a part of this event. Thank you.
Thank you. Cheryl?
No, I'm just excited to participate. Thank you so much.
Yes, thank you for rolling with us, and we really appreciate your support. The National Black Nurses Association is anyone in the house? Dr. Fields, Dr. Ravenne Pierce McDaniel? I think they have a board meeting, but thank you all for being here and supporting us as well. University of Maryland School of Nursing. Anyone from University of Maryland here? Dr.
Hi, good
Cotton?
afternoon. It's Yvette. Hi, everyone. Thank you for coming. So happy to be able to sponsor this. What a great way to start off Black History Month.
Absolutely. And University of Maryland, I always have to give them a special shout out because they've literally been riding with DNPs of color since day one. And they have been a believer in our vision from any type of support we might need, financially, capacity, and as you see them here showing up again. So thank you again, Dr. Conyers, and thank you, University of Maryland School of Nursing. Shout out to Dean Yolanda. Thank you so much. The Johns Hopkins School of Nursing, I'm representing as Dean, but also we have our president of our Black Student Nurses Association here as well, Faith.
Yes, hi, good afternoon, everyone. It's a pleasure to be here with you all, and we are so excited to lead the session next week on the evolution of nursing. We have a very interactive and engaging session planned with you all, so we cannot wait to collectively deepen our understanding on this journey with you next week and throughout this book series. Thank you.
Thank you so much. And the presentation is amazing. So not that I'm biased, but please make sure you come out next week. They have something very special prepared for you all. Also, Coppin State University, Helene Fould School of Nursing. Is Dr. Tillman in the house? Dean Tillman? All right. Well, shout out to Coppin State. Really excited to have them on board as a co-sponsor. The Association of Black Nursing Faculty, I believe Dr. Urson is here. Would you mind saying welcome?
Hello, well, good morning, everyone. Appreciate being a part of this project and seeing the great work that the DNPs of color are producing along with its co-sponsors. I am Ronnie Urson, standing in for Dr. Kathleen Parker, president of the Association of Black Nursing Faculty, and I stand in as the president-elect of the Association of Black Nursing Faculty. Good morning.
Thank you so much. We really appreciate you being here, being a co-sponsor. And also the Black Nurse Collaborative. Is future Doc Meaty Bardinelli in the house? I also represent the Black Nurse Collaborative, so definitely excited to have us on board as well as a co-sponsor. And without further ado, we will pass it over to Maria Smilios, author of the Black Angels book.
Hello, everybody. I am so overwhelmed in a way to see everybody here, and this project kind of came together. It seems like a dream right now. I met Dr. McCamey last June at Johns Hopkins, where I gave a talk. We met. I told her about the Black Angels. I told her about Virginia and Miss Virginia, and we just had a brief conversation. And then we fast forward, went to the DNPs of Color conference. And from there, I'm not going to repeat what she said, things just started happening, and the book club was mentioned. And now we have this national book club for this story. And I am so overjoyed because when I wrote the book, I wanted the whole world to know about these women. It took me 8 years. I'll give you a little bit of background for those who don't know. I am a native New Yorker. I've lived in New York all of my life. Staten Island is part of the 5 boroughs, and I had been there exactly 2 times. I was working as a science editor in 2015 on a book for rare lung diseases. And the doctor in the book was mentioning this new medication, and he likened it to the cure for Seaview, the cure for tuberculosis, which was found at Seaview Hospital in Staten Island. I have always loved history. I have always loved stories about disease and how it moved through my city. And so I Googled it, and up came this story about Seaview and Staten Island and tuberculosis. But tucked alongside of it was another story about Miss Virginia Allen and another nurse who has since passed, who were part of this cohort of Black nurses called the Black Angels. And then I really started to get, I was like, who are the Black Angels? And I started Googling and nothing came up. And I spent 3 days doing this. And then on a lark, I called the museum and they said, oh, we do know Miss Virginia Allen. She is going to be speaking this weekend because we're doing a grand reopening. And so I took my 4-year-old and I took the ferry and went to Staten Island for legitimately the first time in my life. I found her, she gave me her email. And at the time, she was volunteering at the Schomburg, which is in Harlem, across from Harlem Hospital. And we started meeting on Wednesday afternoons for lunch in a little cafe in Harlem Hospital. We sat in these cracked red leather seats and ate lunch. And we kind of talked about everything except the Black Angels. Miss Virginia loves history and literature. And then at the end, she would give me these little snippets and tell me to come back the next week. And normally that would have been fine because I would have gone home and done some research, but there were no archives. The nurses had no archives. And so what I did was I started looking at the backdrop of this story. You know, her aunt came up in the early 30s. I started looking at what was going on in New York City and in history, and then I would come back and we would talk. Anyway, 6 or 7 weeks later, she invited me to her home in Staten Island. And Virginia, do you want to tell them where you live in Staten Island? I think she's muted.
Thank you. I worked at Seaview Hospital from 1947 to 1957. And I lived in the nurses' residence at that time. And circling back, doing many things in between, I moved back to Seaview Hospital and I live in the nurses' residence, which has been renovated for senior citizens. But it's instead of one dormitory room, I have about 7. And it's a lovely space. It's a beautiful park-like setting of many acres. And I have a great view out of my windows. And it gives me fond memories of when I worked here many years ago. And of course, I see the hospital, which I'm not very happy about at this time, because the fire department is using it for their teaching. And they've actually destroyed the hospital. But it's still a beautiful edifice because you can see the outside of the hospital is still intact, but inside it's ruined.
So I show up at her home, which, as Miss Virginia told you, sits in the center of what's now the abandoned Seaview Hospital complex. And we were walking around. It was late summer, and we started walking together, and she pointed to this building and that building, and you got a snippet of kind of what I got in person. And I became really excited and really overwhelmed. And we talked some more. And the story had circulated in Staten Island for many years, but it had never, as I say, gotten on the ferry and made it to Manhattan. And I think that happened because there were no archives. And when I started talking to Virginia and, she said, well, tell the whole story. And I said, how do I do this? And she said, well, I can tell you what I know and then give you the names of other families. And that's how this started. It really became, like this book club, really grassroots. It started with me interviewing Miss Virginia and then talking to another family and another, and then it ballooned. And I would talk to anybody who knew anything about Seaview. And so I put together a proposal about this story that really at the time was Black nurses were called up to New York City and they worked in this TB hospital and they helped with the cure. And it was a very sanitized version of the actual story because it did not fold in the historical events. It did not fold in what was happening at the time in New York with the segregated hospital system. with Seaview being one of 4 out of 29 municipal hospitals that allowed Black nurses to work. It did not fold in the Great Depression, World War II, and all these layers of history that gave this story and gave the women who came up this very, I guess you could say, robust and nuanced history. And so when I sat down to write the story, because it had the nurses, there are 2 narratives to the story, the race for the cure and the nurses' story. The nurses' story had no archives and therefore had no narrative. So for 2 years, I just sat and listened to stories of families and just took copious notes. And then I began to coalesce them, and tropes started coming out and themes. And so the nurse's story is really the voices of all of these families and the patients too. I was able to track down a couple of patients who are still alive from Dr. Robichek's notes, because his son is still alive and he gave me his father's notes. And that's how the narrative thread happened with the nurses. They built it. I was the one who was able to take it, stitch it together into a cohesive story that I wanted it to read like a novel. I wanted it to be accessible to anybody who picked up this book, whether you had a degree in nursing or in medicine, or you were just a lay person who loved reading. And it took me a long time to do that. And so this is how that part of the story came about. I wanted to write the book for a number of reasons. This was another story about women in science who were completely erased from history. There's a very famous photograph of the day that the cure was leaked from Seaview Hospital, of a group of patients who were on death's door and they're jitterbugging in the hallway. It was taken by an extremely famous photographer, Nat Fine, who took the photograph of Babe Ruth when before he hit his 300th home run. If anybody knows, he's leaning on a bat. And he came into Seaview and he took this photograph, and it became global as the sort of iconic image of what happened at Seaview Hospital. But in the back of that photograph, you could see the nurses. And they're there, they have this expression that sort of stayed and like they knew another story. And I had that tacked to my wall for the 8 years that I was writing it, because nobody stopped to ask them anything. The press that descended on Seaview, one person had described it like flies, like a summer swarm of flies. And they just kept walking by the nurses, and nobody stopped to ask them a single question. And so that was really, really moving to me, that, my goodness, how is this, how did this happen? We know why it happened. And I wanted to, that was one of the reasons. The other reason was the story of the patients. The patients that were sent to Seaview, which was at the time considered a pest house, it was on an isolated hilltop in Staten Island, were mainly immigrants and African Americans. They were immigrants who came to the United States looking for a new life, and instead they found the slums and the tenements of New York, and then they found disease, and they found Seaview. And the city considered these immigrants, quote, uncultured, uncouth, immoral, indigent consumptives. They wanted them off of the island. They blamed them for the spread of the disease. And so they shipped them off to Seaview to languish and die. And the only people who were willing to stand up and take care of them were these Black nurses, who were called up when white nurses started quitting for a variety of reasons, mostly because they were tired of dying. And they had a lot of opportunities in the late 1920s for jobs. And this shapes, when you read this week, the first part, the story of the first part really touches deeply on the themes of how Jim Crow played a role in Black nurses being unable to find jobs. I always say the country that drew lines around water fountains and bus stations also drew them around hospitals. Black nurses could only work in Black hospitals. At the time, there were only about 250 versus 6,000 white hospitals. And white hospitals would prefer to have remained understaffed than hire Black nurses. And those that did abuse them verbally and emotionally. So these nurses come up to Seaview and they're sent to this hospital. And the reason they're sent to the hospital, as you'll read, is some people in the city government had a more sinister reason for wanting the nurses there. I'm not going to give it away. You'll read it in the book. We could talk about it next week. The other thing is I want people to just think about the difference between how Jim Crow manifested in the North versus the South. It existed. That is one of the myths that I wanted to dispel, that New York City was heavily entrenched in Jim Crow. There were hundreds of articles. We have them up in the Google Classroom that you could read about Harlem Hospital being a Jim Crow hospital, and how nurses and advocates like W.E. Du Bois and Adam Clayton Powell were advocating for these nurses and to desegregate this hospital and to Jim Crow it, as one newspaper said. The last thing I hope people get is to understand tuberculosis as both a physical and social disease. And somebody in the American Journal of Nursing reviewed the book, and the nurse who reviewed it, put it so beautifully. She said that she understood tuberculosis as a physical disease in the body, but also as a disease that manifested in the body politic in the form of racism and segregation. And so I love the way she described that this was a disease, the microbe was used. It was a racialized microbe, like a lot of other diseases have been used to further ostracize and to further stigmatize people. And so I hope when you come to this story, you can keep all of this in mind and just bring all of whatever thoughts that you have to it. And my hope is that, as Miss Virginia said, everybody knows this story and that you can share it. And so thank you for joining us. And I'm really excited to see where this goes.
Sorry, I'm multitasking over here. So we're going to turn the presentation over to Maria still, as we will be going over the guiding questions. So let me just pop that up on the screen here for us so that we can visualize it as well. Stage is all you, Maria.
So the guiding question for this week is part 1 of the book opens by setting the scene for how racism and segregation plagued the nation in the 20s and 30s. One of the things I used to teach, so sorry if I'm getting a little teacher-like. I'm hoping that everybody will keep in mind how did the unjust political and social climate and barriers to enter the nursing profession from that time shape Edna's, that's Miss Virginia's aunt, who was one of the first nurses to come up from Savannah, Georgia, and the nurses' lives. Many people have said, one of the things, I should have probably said this earlier. I wrote this manuscript 3 times. I originally sold the manuscript when Barack Obama was president and the country was in a different space. And so when I sat down to write it, there were different ideas. Then Donald Trump was elected, and so I put that manuscript aside and began writing it with other ideas in mind. And then COVID happened, and I was in the heart of New York City, where they called it COVID Ground Zero, 1.5 miles from Elmhurst. I saw the ambulances, I heard the sirens, I saw those frontline workers. I saw most of them were Black and brown, and I saw the immigrants because it's situated in a heavy immigrant area. It is a municipal hospital snaking around the block. And I thought, this is a story about who lives and who dies based on the zip code in which you live. And that is wrong. And so the mask debate started happening. And I started to see the parallels of the past and the present. And so I rewrote it a 3rd time. And really, this book is a look back in the past and how it affects the present day. And that's the last question. Have things changed or stayed the same? And really, we now have 2 healthcare systems. One for people who deserve to live or people believe deserve to live, and one for the rest of us. And so when you read that, I think, Joanna touched on this, how does the past inform the present? Why do we need to hear these stories? How can we make these changes? Or have things changed? Or if they haven't changed, what could we learn to make things change? And tuberculosis is not COVID, but tuberculosis became AIDS and AIDS became COVID, and there's always another disease lurking around. But for people who live in poverty, for communities of color, every disease is an AIDS and a tuberculosis because they're not getting. I couldn't believe what I was seeing. I mean, I don't want to go on and on about the experience of COVID in New York, but I think we've all seen it and we all know what went on. So keep in mind, like the past and the present, the book it goes back, but it's very forward looking. It was written with a very forward looking perspective in mind. The Google Classroom. Joanna, do you want to jump in?
Yeah, happily. As you can tell, of all the years of research that Maria conducted to really write this book, to craft it in the way that she did, you can tell. I think I saw in the chat, some of the people saying like how poetic this book is written, and the way that she is taking so many essentially big themes, big topics, big historical periods, and distilling it down to something that is so readable and cinematic. And I saw a lot of comments for those in the chat that have already started it. And so we wanted to make something that would like add to the value of having, as you're reading, a companion. And I'll just throw this here in the chat. So this is the link to our Black Angels Book Club event classroom, and it's completely free. Is it asking you for a class code? Okay, I'll throw that in the link as well if it's asking for the code. But just so that I am not multitasking, let me share my screen here and pull it up so that you can just have a sense of what is waiting for you over this next weeks that we're going to be sharing together. Let me make sure this is, sorry, let me get the right. Okay, great. So can everyone see this? Great. So when you log in, any email or Google login will work. You'll be able to see our book club broken into each part of the book. So when you log in, you'll see our part 1. You'll be able to access who the speaker is, what they're going to be speaking on, and who they are, what their bio is, etc. And then you'll be able to also see the guiding question that is relevant to that part of the book. We also have a who's who. So in our who's who, Maria graciously really gave the visuals of who are the people that she's describing. So when you open any of these, you'll actually kind of have a gallery experience where you can use this toggle to the right of the screen on this arrow, and you can scroll through the different nurses that she is referring to all throughout the different parts of the book. And in addition to being able to see the nurses that this book covers and their lives, she's also given us an additional photo gallery as well that allowed her to craft what it is that she's describing in each part of the book. So these were the images that she used as the inspiration for what she was trying to describe through the different eras and historical periods that the book covers. So she used this in her description. You'll recognize all of the different things that got woven throughout the book, and she shared them all with us here. And in addition, we have resources. So for some of these resources, again, these were things, you can feel free to chime in, Maria, about how she went about doing the research for the different sections of the book. So yeah.
I was just going to say, unfortunately, yesterday I found that Google Classroom confined me to only 20 resources because there's hundreds of them sitting on my computer. And I want to piggyback off of something that Joanna said. I encountered a lot of gatekeeping when I was writing this book and trying to get archives, sometimes from universities, because I wasn't a part of the university, or they didn't consider it. It took me a long time to get it, and from different places. I don't believe in that. If it was up to me, I'm trying to find a place to put all these archives that make them public and accessible for anybody at any given time. So I tried to put up I tried to pick and choose ones that I thought really coincided with what you were going to read. But if anybody is interested, let's say in this particular one that Joanna has up on the screen, and you say, do you have anything more on that? I do. I have folders and folders and just gobs of things put together that I'm happy to share as resources. If anybody is writing on this, I can say, hey, I did all the research for this, and I'm happy to share it because it's out there. It just took 8 years to collate it. And the newspaper articles as well, I'm happy to share them with anybody. If you say, hey, you have any more articles on Harlem Hospital, as if you hit the Harlem protests and stuff, these are all the Jim Crow hospital, right? There's lots and lots of articles about nurses who are calling out the Jim Crow practices happening at Harlem Hospital. So I'm happy. I just want to say I'm happy to share them. It was just, I could only put up 20 at a time.
Yeah, and I think that's something that we really share at Nurses You Should Know, is that we need to make this information as widely available as is possible, because that's how we really close the knowledge gap in our own profession. And so we arranged all of these resources through the different parts of the book. And then at the end, we also included postscript resources. These include links to the active Taking Care exhibit in Staten Island. If anybody lives drivable, if anyone is in kind of the tri-state area, please see this exhibit. It is so extraordinary and remarkable. We also had the privilege of Maria posting additional Black angels whose lives were not necessarily covered in the book itself, but she had found through all of the research that she was going through. So again, just really making sure that people's contributions are recognized. And we included the ways that you can actually find nursing history archives and centers across the country. Ravenne can speak more to this, but there are in existence actual nursing history centers. And so depending on where you are in the country, these could be hubs of information. And there's really amazing scholars that keep these centers and these archives going. We also included a Black nursing history resource list pulled together by Nurses You Should Know that lists different articles, books that Maria had also used in her research that we rely on in our project. And then lastly, we included really a lot of the reckoning with racism in nursing content that has come out, thankfully, to the work of the Commission to Address Racism in Nursing, including their full report in PDF. We also included the episode with Cheryl and Dr. Lucinda Canty, Cheryl Peterson and Lucinda Canty, talking about the Commission's work and what the kind of reflection and changes that are occurring at the American Nurses Association. And that podcast episode is here, as well as the Reckoning with Racism website. So our goal really is to connect the dots and show the through line from the past to the present, through the book club that we'll be going through together over these coming weeks.
Somebody put a question about intellectual property. Any article that's out there, just if you cite it, I don't own it. But the photographs, I ask you if anybody would like to use them. Some of them are taken, like I had those, like the tenement pictures, they don't belong to me. They just were tacked to my wall and they were inspiring. But any photographs of the nurses or their families, if you want them for any particular reason, a project, please get in touch with me and I will get in touch with the families. And because they have to give you permission to disseminate them. And any videos that go up that have to do with, I'm going to put up a few audio recordings of patients who told me about their experience at Seaview. But otherwise, any of those articles, feel free to use them. Just cite the source.
Awesome. And we are at 3 minutes remaining with our time together. Miss Virginia will leave you with the closing remarks, if you would be so kind to grace us.
This has been overwhelming for me. I never dreamed I would be in this setting when I started my nursing career. But I'm grateful that the nurses and Dr. McCamey, your organization, Maria, you're putting a spotlight on the nurses who work here at Seaview. And I just feel so grateful that the history is being told. I love history also. So I'm very, very pleased. And I look forward to you joining us next week and the weeks following. This is an exciting subject. We need to shine the light on nurses, especially Black nurses, who have not gotten the recognition that they should have gotten over the years. So I leave you with those thoughts. And I look forward to seeing you next week. Same time.
That's right. Same time, same Zoom. We also will be broadcasting via our YouTube as well. So if you aren't able to get in, that's another way to listen in. But we look forward to seeing you all next week, next Saturday, 1 p.m. Eastern Standard Time. Be on the lookout for the emails with the guiding question, the link to the Google Classroom, and there'll be an email that you can send any inquiries or questions that you might have. But thank you all for joining us and have a good rest of your weekend. Take care.